Okay, I'm going to start. So I want to thank all who have come today for the second annual Paul M. Schyve Lecture. Just a little background about Dr. Schyve. Paul Schyve, a Rochester native, credits his education at the University of Rochester as playing an important formative role in his professional career. He describes his interest in bioethics as being sparked by the teachings of John Romano, founding chair of the Department of Psychiatry. Dr. Romano and Dr. George Engel were collaborators and pioneers of mind-body medicine, and Dr. Engel's classic 1977 article, The Need for a New Medical Model, A Challenge for Biomedicine, was part of a larger education reform across the country and greatly influenced medical education here at the University of Rochester. Paul then became increasingly interested in the ethics of healthcare in 1986 when he joined the Joint Commission and developed accreditation standards related to clinical research and organizational ethics. He ultimately became senior advisor for healthcare improvement at the Joint Commission before his retirement in 2016. A steadfast supporter of the University of Rochester Medical Center, Paul made a visionary gift in 2014 to endow the new Center for Bioethics at the university, providing enduring support to the study and practice of bioethics in clinical care, the health delivery system, and life sciences research. His thoughtful commitment builds upon a lifetime dedicated to improving patient care and promoting human dignity, creating a legacy at the university that will touch countless lives across generations of patients. So it is my great pleasure today to introduce this conference to begin by speaking with Dr. Schyve himself. Welcome, Paul.
Thank you, Lainey. I'm very pleased to be here.
Awesome. So as I mentioned in that short introduction, which didn't do half of the credit that I should give for your wonderful career, I just want to say that it's been a decade since we established here at the University of Rochester the Paul M. Schyve Center for Bioethics. And I would love to hear a little bit about your experiences here at the university that led to this endowment that would help ensure that future generations are imbued with the biopsychosocial approach to medicine.
Well, it actually started with my undergraduate years, even though I was pre-med, which meant I had the required physical sciences and the mathematics. I spent actually most of my time in the humanities and in social sciences, which made me understand the breadth of the different types of values and value systems that people have and the struggles that they have in trying to resolve their conflicts and their puzzlement in their ethical decision making. Obviously, when I got to medical school at Rochester, the primary focus initially was going to be on clinical ethics and particularly the patient-physician relationship. But at that point, it soon became clear to me that there were also ethical issues in terms of the relationship with the nurses and with other healthcare providers, as well as my fellow students. And also, there was the organizational issues. What were the ethical relationship between the hospital and the medical school and me as a student? So all those things were puzzling in some ways. And soon after the introduction to the medical school, we had our lectures from Dr. George Engel on the biopsychosocial model. And I found it very helpful in understanding how to think through some of those conundrums. So that was really the first time that I started to realize how important ethics were going to be in my career in healthcare. I think the biggest contribution really occurred during my residency in psychiatry. Dr. John Romano, who, as you mentioned, was the founding chairman, was still chair of psychiatry while I was a medical student and continued teaching as an emeritus professor after he retired at the point I got into residency. And so we would have these very formal kind of presentations. We'd call them the Romano presentations. I mean, they were so formal, we'd actually have refreshments served about midway through. And the student or the resident would give this very elaborate presentation about one of their patients. And Dr. Romano, who is truly a Renaissance man, would bring in all kinds of thoughts from history and literature and everything else about how that applied to the particular patient that we were presenting. But I remember specifically one of my presentations, and as a medical student who spent a lot of my time in psychiatry and then as a resident, I had more than one of them. Uh, and I remember him asking me specifically, well, what are her religious beliefs? What are her religious values? And that's when I realized how important those issues were in terms of the ethical beliefs of the patient and my relationship to the patient. You mentioned to me recently that somebody had suggested maybe it should be called the psychosocial spiritual model. I don't think Dr. Romano would have objected to that. So that by the time I left my residency, I was quite convinced that the ethical issues in healthcare were really central to providing good healthcare, both to individual patients, to the families, to the community, and ultimately to society. So that led me to decide that it would be a nice idea to endow a center, and where else, obviously, than the university had put me together for my career.
That's a great story, and again, we really do appreciate your generosity. So you've told the first part of the story. I now want to just ask the second part. Was since graduating the University of Rochester, you have been heavily involved in ethics and health policy with your work at the Joint Commission, and I would love to hear you tell a little bit about your work experiences that led you to really think about the Schyve Center as having a public facing, as well as an education for the residents and the medical students and the faculty here at the university.
Yeah. Well, let me actually go back to what I was doing just before I went to the Joint Commission in 1986. I spent 10 years in the Illinois Department of Mental Health and Developmental Disabilities, initially as the director of an inpatient site research unit. So I had to be very conscious of not just the clinical ethics, but the research ethics at that time. And that particular hospital has, as many psychiatric hospitals had at the time, a catchment area that it served. So it also made me very aware of the ethical relationships between the community and the healthcare system. That led to this kind of very global view of what were the ethical issues involved in healthcare. It was clearly much further, much broader than just the question of the patient-physician relationship. And then when I went into the Joint Commission in 1986, one of the first things I was involved in was we were writing standards for patient rights, for research ethics, for cultural competency, for dealing with disparities in healthcare, all the kind of issues that in some ways you might call hot buttons in patient ethics and in healthcare ethics. So I became very much involved in those things. And of course, the Joint Commission was influential throughout the country, in fact, throughout the world, around those issues. And as a result, I often found that when I became a senior officer there, that I was being invited to participate in organizations that were dealing with ethical issues. Everything from the Institute of Medicine, now the National Academy of Medicine, to the Hastings Center, to professional organizations, to consumer organizations. And it became very clear, even more clear than it had been, about how different groups may have different values and how even within one person there may be a conflict among values. It's often not a conflict that they disagree about the values, it's that they place different valencies on the values. And so when you take one action to try to maximize one value, turns out it compromises another one. And that can differ across different groups and even among families and certainly across cultures. And that's why healthcare is in many ways imbued with all these kind of ethical issues. at the individual level, at the community level, at the family level, even at the societal level. And it just seemed to me that it was important to involve all the different stakeholders as we try to resolve some of those issues. And my experience, for example, in dealing with the Society for Bioethics and Humanities, that asked me to be on the task force developing a list of competencies for healthcare ethics, ethical consultants. And then as a member and later chair of the oversight body of the AMA Institute for Ethics, led me to understand the importance of having multiple stakeholders, including specifically from the community, involved in all those kind of discussions. And so it becomes increasingly important not just to involve people, but to educate people from multiple communities and multiple stakeholder groups about these issues so that they can be clear about them, they can identify them for themselves, they can discuss them, discuss what might be an ethical decision, and therefore be able to resolve issues in an ethical way. And that's why I thought it's very important to establish a bioethics center that would have that kind of facing toward the community, that it brings in many different stakeholder groups, not just within healthcare, but also outside of healthcare.
Well, thank you very much. This is a wonderful way for us to start our conference. Hoping that the third annual anniversary, that maybe we can even bring you out here to Rochester. So thank you very much, Paul. And again, thanks again for your generosity.
Thank you.